There is a disease you may rarely hear about, yet it's extremely dangerous and silently claims the lives of hundreds of thousands of people every year. That disease is pancreatic cancer. Have you ever felt chronically tired, experienced unexplained weight loss, or noticed that your stool smells unusual or floats oddly on the surface of the water, and simply thought it was due to irregular eating habits, stress from work, or assumed you'd just feel better in a few days? Sadly, many people think the same way until it's too late. Pancreatic cancer is one of the most difficult cancers to detect because the early symptoms are often very vague and easily overlooked. The pancreas is located deep within the abdomen, behind the stomach, which makes early diagnosis even more challenging. And unfortunately, by the time most people are diagnosed, the cancer has already spread, and treatment options become extremely limited. But there is still hope. By listening to your body and recognizing the early signs that the pancreas may be quietly sending out, you can absolutely detect the disease in time, receive more effective treatment, and possibly even save your own life or that of a loved one. In today's video, I'll share with you 10 early warning signs of pancreatic cancer. Some are very noticeable, while others are extremely subtle, but all of them could save your life if caught in time. So, don't miss a single second of this video. You might just become the one who helps save someone's life by sharing this information at the right moment. So, what are the first signs your body might be trying to warn you about? Let's begin with a symptom that is very easy to notice with the naked eye, but is often mistaken for a liver condition. That is jaundice, a highly important sign associated with pancreatic cancer. Jaundice. The first symptom, and also one of the easiest to observe, is yellowing of the skin and eyes. But what's really going on inside your body when you start seeing your skin turn yellow? When a tumor forms at the head of the pancreas, it can press on the common bile duct, which is the duct that carries bile from the liver to the small intestine. When bile cannot flow as usual, it builds up and backs into the bloodstream. Bile contains a yellow pigment called bilirubin, and when this pigment accumulates in the blood, it causes your skin to turn yellow and the whites of your eyes to become yellowish as well. Not only that, your urine may become dark brown, like strong tea, and your stool may appear unusually pale, because bile is no longer entering the intestines to help digest fats and give stool its typical color. This is an extremely important sign that must not be ignored. Many people mistake it for hepatitis, allergies, or simply poor diet. But in reality, it could be a warning from the pancreas, an early stage sign of cancer if detected in time. If you or a loved one begin to notice such changes, don't hesitate. Seek medical attention immediately. In many cases, it was the decision to see a doctor just because of slightly yellow skin that helped patients detect pancreatic cancer early and significantly increased their chances of survival. Unexplained weight loss. After identifying a visible sign like jaundice, let's move on to a symptom that is often misunderstood as a positive thing: weight loss. But remember, weight loss is not always good news, especially when it happens without any effort on your part. Under normal circumstances, your weight only changes significantly when you adjust your diet, increase physical activity, or make major lifestyle changes. However, if you begin to lose weight rapidly, for example, more than 5 kilograms within a few weeks to a few months, without altering your daily habit, this could be a serious internal warning sign. And pancreatic cancer is one of the causes that must be considered. The reason is that the pancreas plays a key role in digestion. It secretes enzymes that help break down fats, protein, and carbohydrates in food. But when the pancreas is damaged by cancer, its ability to produce these enzymes declines, leading to inefficient digestion and poor nutrient absorption. This means that even if you're still eating 3 meals a day and consuming the same number of calories as before, your body may still experience an energy and nutrient deficit. The result is unintended weight loss, muscle wasting, fatigue, and prolonged weakness. What's more concerning is that this symptom is easily overlooked in modern life. Many people blame it on work stress, lack of sleep, or simply assume it's due to their constitution or age. But this complacency has led to many cases of pancreatic cancer being detected too late, when the disease has already spread and treatment options are very limited. Therefore, if you notice yourself getting thinner day by day, your clothes fitting looser, or if people around you keep commenting that you look thinner, take it as a signal from your body. Ask yourself, have you changed your diet? Have you started exercising differently? If not, don't wait. Get a health checkup as soon as possible. Pancreatic cancer doesn't cause obvious pain in its early stages, but it does cause subtle changes, and unexplained weight loss is one of the most important among them. Abdominal pain radiating to the back. One of the notable signs that is often overlooked or mistaken for common digestive issues is persistent, dull abdominal pain, especially in the upper abdomen, right below the breastbone, near the stomach. What's noteworthy is that this pain doesn't just stay in the abdomen. It can radiate to the back, leading many people to think they're dealing with back muscle pain, spinal degeneration, or discomfort from sitting too long. However, in clinical practice, this is a typical sign seen in early to intermediate stages of pancreatic cancer. The reason is that the pancreas sits in a very particular location, deep inside the abdomen, near the spine, and close to many important nerves. When a tumor begins to grow in the pancreas, it can press on or cause inflammation in the nerves behind it, leading to pain that radiates to the back, a symptom that not everyone would associate with the pancreas. So, what are the characteristics of this kind of pain? It is not a sharp, intense pain like that of appendicitis or acute gastritis. Rather, it's a dull, lingering pain that may feel achy, hidden, or vaguely uncomfortable, but not clearly defined. Notably, the pain often worsens at night, especially when lying flat, because the intra-abdominal pressure changes, allowing the tumor and surrounding structures to press more heavily on the nerves. Many people simply think it's probably indigestion or poor posture. Then they take painkillers, apply medicated oil, or use back pain patches, without realizing that this recurring pain might be an internal warning that a tumor is silently growing in the pancreas. Another important point: when abdominal pain is accompanied by weight loss and jaundice, the likelihood of pancreatic cancer rises significantly. This trio of symptoms is classic, and anyone experiencing them should undergo early screening, especially those over 50, long-term smokers or alcohol users, or people with a family history of cancer. In summary, if you feel a persistent dull pain in the upper abdomen, sometimes radiating to the back, more noticeable at night, and with no clear cause such as injury or posture changes, listen to your body and get a health checkup as soon as possible. Because if detected early, the chances of successfully treating pancreatic cancer are much higher than waiting until the disease becomes advanced. Persistent digestive issue. If you frequently feel bloated, nauseous after meals, or suffer from prolonged indigestion without a clear reason, you might simply assume you're dealing with common digestive problems. However, if these symptoms persist for several weeks and do not improve even after changing your diet, taking digestive enzymes, or using stomach-supporting medication, it's time to pay closer attention. This may not just be a simple stomach or intestinal issue. It could originate from a very important organ that is often overlooked in diagnostics: the pancreas. What role does the pancreas play in digestion? The pancreas produces digestive enzymes, such as lipase for fat, protease for protein, and amylase for carbohydrates. These enzymes are essential for breaking down food into nutrients the body can absorb. But if the pancreas is damaged by a tumor, its ability to produce enzymes significantly decreases. The result, the digestive process becomes less efficient. Especially, fats are not properly broken down, leading to a range of symptoms like a feeling of fullness or bloating after meals, even with small portions, persistent nausea, reduced appetite, abnormal stool, foul smelling, pale colored, loose, and floating in the toilet bowl. This is a telltale sign of steatorrhea, or fat in the stool, indicating poor fat digestion. Why is this symptom dangerous? because it is easily mistaken for common digestive issues like gastritis, functional gastrointestinal disorder, or irritable bowel syndrome. This leads many people to underestimate the situation and pursue the wrong treatment path for months. By the time more severe signs appear, such as rapid weight loss, jaundice, or back pain, the disease may have progressed significantly. In early-stage pancreatic cancer, digestive issues are sometimes the most noticeable symptom, even more so than pain or jaundice. You should seek medical attention if you've been experiencing the following symptoms for several weeks: bloating, gas, or indigestion after meals, persistent nausea without a clear cause, foul smelling, pale, floating stools. These could be signs of an underlying digestive issue that requires professional evaluation and treatment. You should get your pancreatic function checked. Doctors may order blood tests to measure pancreatic enzyme levels, an abdominal ultrasound, or a CT scan for a more accurate diagnosis. Early detection not only leads to more accurate treatment, but also significantly increases the chances of success, especially for dangerous conditions like pancreatic cancer. Loss of appetite. Have you ever suddenly lost your appetite, even though you were eating normally before? Food no longer seems appealing. You get full after just a few bites, or even the sight of food makes you feel exhausted. Many people ignore this sign, thinking it's just stress, fatigue, or a temporary mood swing. But in reality, a prolonged, unexplained loss of appetite can be one of the earliest signs of a serious issue with your pancreas. Why does pancreatic cancer cause appetite loss? The pancreas not only produces digestive enzymes, but also affects various hormones related to hunger, metabolism, and endocrine function. When there's a tumor or damage to the pancreas, the balance of hormones like insulin, glucagon, and others is disrupted. The digestive system also slows down, making food harder to digest, which in turn causes a lack of interest in eating. Additionally, a pancreatic tumor can cause low-grade inflammation in the abdominal area, altering the function of the enteric nervous system, which controls sensations of hunger, fullness, and stomach motility, making you feel full quickly, eat less, or feel nauseous while eating. What are the consequences? These appetite changes usually lead to reduced food intake and lower calorie and nutrient consumption each day. Gradually, the body starts losing weight without you intentionally dieting or increasing your physical activity. This is a slow but dangerous process because in many cases, unintentional weight loss combined with loss of appetite is one of the earliest signs of early-stage pancreatic cancer. You should see a doctor if you've experienced a loss of appetite lasting more than 2 weeks without a clear reason like flu, colds, or psychological stress. If you get full more quickly than usual and eat much less, or if you're losing weight along with appetite loss while maintaining normal routines and energy levels, these could be signs of a more serious underlying condition that requires medical attention. Don't delay. Be proactive and visit a hospital for a comprehensive checkup, including blood tests, abdominal ultrasound, or a CT scan to evaluate pancreatic structure and function. Appetite loss is not just a symptom of being tired. It could be the first warning sign your body is trying to send you that something deeper is wrong. New onset diabetes without prior history. Have you ever heard someone say they were perfectly healthy, eating well, not overweight, with no family history of diabetes? Then suddenly, one day, they go for a checkup and are diagnosed with diabetes. This situation is not uncommon. Alarmingly, about 1/4 of pancreatic cancer patients are diagnosed with type 2 diabetes just a few months before their cancer is detected. This suggests that new onset diabetes in older adults may not just be a routine metabolic condition. It could be a warning sign of something more serious involving the pancreas. Why can pancreatic cancer cause diabetes? The pancreas is responsible for producing insulin, the primary hormone that regulates blood sugar levels. When a tumor forms in the pancreas, it can damage or destroy the beta cells that produce insulin. This leads to a sharp drop in insulin levels and a rise in blood glucose, resulting in a diabetic-like state. However, unlike typical type 2 diabetes, which is often caused by insulin resistance, This form of diabetes is due to actual insulin deficiency because the pancreas has been structurally damaged. Who should be particularly cautious? Individuals over 50 years old who are suddenly diagnosed with diabetes despite previously being in good health. Those with no typical risk factors such as obesity, sedentary lifestyle, high sugar intake, or a family history of diabetes. People whose blood sugar rises quickly and becomes hard to control within a short period. And patients who also experience loss of appetite, weight loss, digestive problem, or abdominal pain. These are high-risk cases and should be screened for pancreatic cancer as early as possible. What should you do if this happens to you or a loved one? Don't take a new diabetes diagnosis lightly, especially if there's no clear cause. Ask your doctor to evaluate pancreatic function, especially if other warning signs are present like jaundice, abnormal stool, or rapid weight loss. Consider undergoing a CT or MRI scan of the abdomen. Testing for pancreatic tumor markers, for example, CA19-9, or an endoscopic ultrasound if needed. A diabetes diagnosis is not always the end of the story. Sometimes it's just the visible tip of a hidden tumor deep inside the abdomen. So never ignore a newly developed condition that doesn't match your lifestyle or known risk profile. Unexplained blood clot. Did you know that one of the early signs of pancreatic cancer may not appear in your digestive system, but rather as a blood clot? It may sound unrelated, but this is actually a dangerous warning sign that many people tend to ignore. Why does pancreatic cancer cause blood clots? When a malignant tumor forms in the body, especially in the pancreas, the cancer cells can release substances that increase blood clotting. At the same time, systemic inflammation and changes in the blood vessel walls make the blood more prone to clotting. This condition is known as cancer-associated hypercoagulability. As a result, patients may develop thrombi, or blood clots, without any obvious cause. What are the common signs of thrombosis? Swelling, pain, warmth, and redness in one leg, especially in the calf, may indicate deep vein thrombosis, or DVT for short. Sudden shortness of breath, chest pain, and a choking sensation could signal a pulmonary embolism, or PE, a life-threatening emergency. Sometimes, blood clots may also form in arm veins, abdominal veins, or even cause strokes in people without any known cardiovascular risk factors. Why is this dangerous? Because people often attribute these symptoms to heart disease, lack of movement, or side effects from birth control pills, without realizing that these could be red flag signs of cancer. Pancreatic cancer is one of the most common malignancies associated with unexplained DVT. In fact, some patients are diagnosed with blood clots before they even know they have cancer. When should you be suspicious? If you suddenly experience swelling and pain in your leg without injury, trauma, or prolonged sitting bed rest. If you develop acute shortness of breath or chest pain, and heart tests reveal nothing abnormal. If you have a blood clot while still young, healthy, and not on medications that promote clotting, especially when these symptoms are accompanied by weight loss, poor appetite, jaundice, or digestive problems, what should you do? See a doctor immediately if you experience any of the above symptoms. Don't delay, because thrombosis can become fatal very quickly. Ask your doctor about the possibility of screening for hidden cancers, especially pancreatic cancer. If no clear cause is found, blood tests like D-dimer, vascular ultrasound, abdominal CT scans, or cancer marker tests may be recommended if cancer is suspected. A blood clot isn't always a random event. Sometimes, it's your body sounding the alarm about a potentially dangerous underlying condition. And if you've experienced any of these symptoms, listen carefully to what your body is telling you. Generalized itching. Itching may sound like a minor issue. Everyone experiences it, right? But if you're experiencing persistent itching without any rash, allergies, or reactions to food or cosmetics, and the itch feels deep beneath the skin, especially on the palms, sole, or back, don't take it lightly. This could be one of the earliest signs of pancreatic cancer. Why does itching occur? As mentioned earlier in the section on jaundice, bilirubin is a bile pigment, When a pancreatic tumor compresses the bile duct, bile flow becomes obstructive. Instead of draining into the intestines to aid in fat digestion, bilirubin builds up in the bloodstream and infiltrates the tissues under the skin. This excess bilirubin causes intense, persistent itching, sometimes even before jaundice becomes visibly apparent. Characteristics of itching due to pancreatic conditions include dull, widespread, generalized itching, usually without a rash or visible irritation. And scratching provides no relief. The more you scratch, the worse it gets, especially at night. Itching is commonly felt on the palms, soles, back, and arms, and may be accompanied by fatigue, loss of appetite, and dark-colored urine. Why is this dangerous? Many people see a dermatologist and are treated with anti-itch creams or allergy medications to no avail. They may live with the itch for months, not realizing it's an internal issue related to the liver, gallbladder, or pancreas. Itching is one of the earliest systemic symptoms of bile duct obstruction. When accompanied by other symptoms like jaundice, abdominal pain, pale stools, or appetite loss, it strongly suggests serious issues in the pancreas or hepatobiliary system. When should you worry? Persistent itching for over 2 weeks, unresponsive to allergy medications, no clear cause such as allergies, weather, or skincare products, itching accompanied by digestive changes, urinary changes, or weight loss, sudden, unexplained itching in someone previously healthy. What should you do? Don't self-medicate with over-the-counter itch remedies. Get your liver function tested, including liver enzymes and bilirubin levels. If suspicious, your doctor may recommend an abdominal ultrasound, CT scan, or MRI to screen for pancreatic and bile duct issues. Itching isn't always just skin deep. When paired with other symptoms, it could be the body's early warning signal that something serious is going on. Early detection could save your life or the life of someone you love. Persistent fatigue. Feeling tired is something everyone experiences. However, fatigue caused by pancreatic cancer is very different from typical tiredness due to sleep deprivation or overwork. This is a deep, whole-body exhaustion that persists and doesn't improve even after rest. Sufficient sleep, proper nutrition, and low stress levels. In pancreatic cancer, fatigue results from multiple overlapping mechanisms that drain your energy and diminish bodily function. First, the presence of the tumor can trigger systemic inflammation, a reaction of the immune system against the cancer. This inflammatory process consumes energy, damages healthy tissues, and leaves the body feeling sore, fatigued, and lethargic. Second, the tumor reduces the pancreas's ability to secrete digestive enzymes. Even with regular eating, the body fails to absorb adequate nutrients and energy, leading to exhaustion. Third, cancer may lead to anemia through various mechanisms. Reduced red blood cell production, microscopic gastrointestinal bleeding, or disrupted iron metabolism. Anemia causes oxygen deficiency in tissues, resulting in prolonged fatigue, dizziness, and mild shortness of breath. Lastly, pancreatic cancer can disrupt hormone production, particularly insulin, leading to metabolic imbalances and unstable blood sugar levels. This can manifest as fatigue, irritability, mild depression, or lack of motivation. Many people overlook persistent fatigue, blaming it on age, workload, or stress. But if it lasts more than 2 weeks, with no clear cause and doesn't improve with rest, it could be your body sounding an internal alarm. Don't hesitate to get a full health checkup, including pancreatic function screening, changes in stool and urine color. One of the more visible yet often overlooked signs is a change in the color of your stool and urine. Two excretory products that clearly reflect your internal health status. In pancreatic cancer, especially tumors located in the head of the pancreas, the tumor can press against the common bile duct. This is the duct that carries bile from the liver and gallbladder into the small intestine. When compressed, the bile flow becomes obstructed and cannot reach the intestines as it normally should. This condition is known as bile duct obstruction, When bile is obstructed, bile pigments, primarily bilirubin, are no longer excreted through the stool, but instead accumulate in the bloodstream. They then seek alternative routes of elimination, such as through the kidneys, urine, or by depositing in the skin and eyes. As a result, you may observe pale or clay-colored stool. The usual brown-yellow color is lost due to the lack of bile pigments. The stool may also float and appear greasy due to undigested fats. Additionally, dark urine, resembling strong tea or even cola, may occur. This happens when bilirubin is diverted to be excreted via the urine, giving it an unusually dark color. These changes are not just signs of digestive issues, but are key indicators of bile duct obstruction, potentially related to the pancreas. If accompanied by other symptoms such as jaundice, itching, unintended weight loss, or fatigue, you should seek medical evaluation promptly. These are very specific signs and should not be taken lightly. Even if you don't feel pain or other severe symptoms, any persistent changes like pale stool and dark urine, especially when unrelated to medication or diet, should prompt further investigations such as abdominal ultrasound, bilirubin testing, liver enzyme tests, or pancreatic imaging. Conclusion: we've just covered the 10 early warning signs of pancreatic cancer, a silent but extremely dangerous disease. What makes pancreatic cancer so frightening is not just its aggressiveness, but the fact that it often progresses quietly and is hard to detect. However, by understanding the symptoms, from jaundice, weight loss, digestive disturbances, fatigue, itching, to changes in urine and stool, we have a real chance to detect the disease early and improve treatment outcomes. These 10 signs are not meant to make you anxious, but to equip you with knowledge, help you listen to your body, and recognize red flags early. Remember, a small change, if noticed in time, can be the turning point that saves your life. Don't ignore what seems trivial. A persistent itch, unexplained weight loss, or unusually dark urine could be your body's way of whispering that something more serious is going on. If you found this video helpful, share it with your friends and loved ones, because your small action today might help someone detect cancer early and escape its grip. Don't forget to like, subscribe, and hit the notification bell so you won't miss future valuable health content. See you in the next video, where we'll continue exploring the incredible signals your body gives you. Wishing you and your family health, joy, and a life full of awareness.